Hello, everyone, and welcome on behalf of the Center for Global Development and Innovations for Poverty Action, with whom we're pleased to be co-hosting this event today. I'm Sarah Rose. I'm a policy fellow at CGD, and today we'll be exploring how research and evidence have really served the policy community's needs during the COVID pandemic and as they plan for recovery. So when the pandemic hit, everything was turned upside down fairly suddenly. Governments across the globe really found themselves with new and urgent needs, both to understand more about the context they were facing and the new needs that had arisen fairly suddenly, as well as how their responses were working. And meanwhile, with restricted mobility for so many, a lot of the standard ways of gathering evidence about these very things became much less tenable. So policymakers, research teams, donors that support them have had to pivot quickly in how they work together to co-create new and often innovative ways to gather data and craft evidence-informed policy responses. So we'll hear about some of the successes and challenges in doing so over the past year. And in looking back, we'll also hope to chart part of the path forward, both for the long road ahead on COVID response and also for thinking about how to be better prepared to meet the urgent evidence needs that may arise in any future crises. So, the imperative to get this right is particularly strong, given the sheer magnitude of the need that the globe is facing right now, as well as the serious fiscal pressure that most governments and donor governments are facing these days. And so the role of evidence is really more important than ever. And so in understanding what the needs are, in planning and targeting policy and programmatic responses, and then in understanding their results. So today we've got a great set of experts. We have people from the policymaking community, from the research community, from donor communities, lined up today, and I'm really looking forward to hearing from them about their experiences over the past almost year, the lessons that they've drawn from them, and then their take on where we go from here. And so I'll just take a quick minute to introduce them, and then we'll get started on the panel for today. So joining us today, we have Danielle Gomez Gaviria, who is the Deputy Director of the National Planning Department of the Government of Colombia. We have Rada Rojkotia, the Chief Research and Policy Officer at Innovations for Poverty Action. We have Mariam Akmal, a Senior Policy Analyst with a Global Education team here at the Center for Global Development. We have Eunice Akwe, Senior Education Specialist at the World Bank's office in Ghana. And also Josh Kaufman, who's had a long career at USAID, and he's currently the Director of the Office of Policy. And at the end, of course, we'll also want to hear from you, our audience. We'll make sure we leave time at the end to address any questions you may have, and you can post these to the panel at any time during the event by emailing events@cgdev.org, by tweeting @cgdev, #CGDTalks, or by submitting a comment via the YouTube live stream. So to start off our discussion today, I'm going to give each panelist a couple of minutes to give a quick overview of the efforts that they've been involved in to collect data and produce evidence to understand the impact of the COVID pandemic, or to inform plans for recovery and response. Now, I'm sure that they all have volumes to say about this, but as a starting point, we're going to begin with sort of a short version, just a couple of minutes to help provide some context about where they're coming from that will help really position the remainder of the discussion. And so we're going to start today with the policymaker angle. So Danielle, your agency, the National Planning Department of Colombia, has a broad scope. It has influence over policymaking and implementation across sectors, across the government. So I'm sure there's a lot to say, but hoping you can give us some quick highlights of what it is you've been doing with this in respect to this.
Absolutely, Sarah. Thank you very much to CGD and IPA for the invitation, and hello to everyone participating on the panel and listening in. So indeed, I think that from the policymaker point of view, we had to deal with a big challenge in terms of the type of data that we needed to make decisions, and the trade-off between decision-making with better information but later versus incomplete information but faster, right? So this is, remember that we were making decisions in the context of absolute uncertainty about the scope, the depth of the crisis, the impacts, and we had to really leverage our existing capabilities and also our network of collaborations with researchers and with organizations like IPA, among others. So I want to give you a broad brush of how in Colombia we addressed the needs of data and evidence evidence-based policymaking in this very challenging context and give you some examples. So a broad overview of the examples, and then I want to focus a bit longer on one of our key case studies or examples of how we use the data to actually design and put in motion a new social program that was key to protect incomes of vulnerable households. So first of all, I think I would like to mention the IPA Recover Survey that we worked on with the National Planning Department, and how this addressed the need to collect timely data to support evidence-based decision making, and to really transform the speed at which we were collecting data. Second, we really improved and made an effort to have these evidence gap maps. And this is important because it's just reviewing existing data to be able to make the best possible decisions without having to collect necessarily new data. No, we made efforts to construct these information dashboards. We worked with Instiglio, with Global Affairs Canada, with the World Bank. Within the government, we built these COVID information dashboards that were very important to be able to monitor and track the evolution and the impacts, the social economic impacts of the COVID pandemic as it unfolded. So that's like in general. We really had to make an effort in terms of interoperability of the databases. That's key in Colombia. That's still a challenge, and I bet it's a challenge elsewhere as well. But lots of the government agencies have their databases, and they don't speak between databases. No, so we really had to make an effort, and we identified these gaps in terms of our capabilities. In particular, so our key program last year was the unconditional cash transfer program, Ingreso Solidario. This cash transfer program required the use of a bunch of databases from the private sector, the public sector, to be able to identify populations that would fall back into poverty due to this shock. So the first thing we had to do was work on simulations to understand the impact on poverty of COVID. So we worked with FEDESarrollo, which is like our local Brookings institution, a think tank, the World Bank, the National Planning Department, to be able to, using all the data for our social programs, understand and simulate what the impact would be. Then we had to identify which of these populations to be able to design the targeted transfer program and to operationalize it. So this required working, for example, with the whole financial sector, 21 institutions, to be able to identify which beneficiaries had a banking account. Then we had to work with the telcos, so the telecommunications agency firms, to be able to identify those that did not have a banking account and be able to implement at a record speed a program to create digital products, digital banking products, to be able to make to operationalize the transfer programs to protect incomes during the initial phases of the pandemic. Within government, we also had to build this master database, including data from CISBEN, which is our registry of households in Colombia. This is the database that we use to target social programs, and we had to construct this database with these registries and with the administrative databases of the social programs to identify who didn't have any type of support and be able to better target our transfers. So I think I'm going to wrap up there, Sarah, but emphasizing the need of interoperability, one, of updating information, and also just highlighting the need from the policymaker point of view of being comfortable or being uncomfortable making decisions with very incomplete information, with outdated information, and how to manage that trade-off between the urgency of programs and the need and our commitment and how convinced we are that it's very important to make decisions with evidence, but it was very hard in this context.
Thank you very much, Danielle. I think the theme of trade-offs might be one that emerges throughout the conversation that we're going to have today. You certainly raise an important one, thinking about we need to make fast decisions. We have some data available, may not have all the data available that we need. So in a period of uncertainty, how do you think about trade-offs between sort of better data, faster data, and how that looks too? And certainly the technical challenges of thinking about interoperability, how to think about drawing on different areas of administrative data is also really critical. We're going to take a step out now and talk to a couple of the researchers that we have today, or folks who are bringing the research perspective as well. So Radha, let's turn to you first. So IPA works globally, creating evidence, transforming evidence into policies and practices across the globe to help the poor. Danielle mentioned the Recover survey that IPA has been doing in a number of different countries. Hope you can give us a brief overview sort of what IPA has done over the last year or so during the COVID pandemic. Thanks.
Yeah, hi Sarah, thanks, and happy to do so, and hi to everyone. It's great to be with you today. So I think there's a few things that, and I'm so pleased that Danielle opened with such a good, vivid view of that, the challenge of the process, and it gives a good sense of just the lived reality of trying to make these decisions, and the fact that decisions need to be made anyway, with or without the data being available. So kind of motivating us all in terms of what we should be focused on. So IPA, as you said, IPA is known for its work in conducting RCTs. We've conducted over 800 evaluations globally. We have offices in 22 countries where we've been able to contribute both to policy making, but also then to just the knowledge base and academia. But over the past several years, we've moved much more fully into playing a mediator role between the evidence sector and evidence generation and the policy making, decision making process. So in these 22 country offices, we work with dozens of ministry partners, planning departments, government offices, and like our partners in Colombia, to really help design strategy development, implementation, monitoring, and then evaluation. So the COVID crisis was unique. It gave us all a chance to quickly shift and really focus on how we could really walk the talk around evidence-based policymaking, but in a very distinct environment. So I think as our government partners, we're trying to rethink their tools, whether it's about education provision, social protection, cash assistance, all of those normal emergency responding tools that might be deployed suddenly needed to be reevaluated, just given the very distinct nature of the pandemic. And in a similar way, I think it forced us to rapidly rethink our research and policy engagement tools. So we'll talk a little bit more, I think, about the research pieces later. I will say, as Daniela mentioned, we did initiate a multi-sector diagnostic tool. So this was called the Recover survey. So this was really designed to help governments diagnose how COVID was affecting their populations and households across a number of different measures. So whether it's education, social protection, income loss, food security, even just questions around stress and anxiety, intra-household tensions resulting as a consequence of the crisis. So today we've implemented this 16 times, this survey, 16 times across 9 different countries. So we've been able to do multiple rounds, and I think both the initial snapshot that it provided was useful, but I have to say that being able to repeat this over time, I think to Danielle's point about when is this information good enough, being able to repeat those surveys also provided an opportunity to gut check and fact check some of those assumptions that we may have been making earlier on. So we'll touch on some of the changes in research later, but I did want to draw out just for this panel a couple of specific changes I think that we needed to make as IPA plays this sort of mediator role with policy partners. I wanted to just draw out some of the changes that we needed to make just in terms of how we do that policy engagement work in steady state, what I'll call steady state, versus in COVID. And I think that may help us focus some of our discussion. So in steady state, I would say, in best case, what we're looking for is working with government partners where we know what the policy opportunity is, right? So in a most simple, if I simplify it, it will be working with the Ministry of Education who's thinking about wanting to prioritize, X kind of outcome, or a Ministry of Labor that's focused on introducing this, Y kind of initiative. And so there is there's a very specific policy opportunity and a very specific entry point. In COVID, what we found was our government partners were really trying to deal with all of those questions all at the same time. So we had a very diffuse set of opportunities across multiple sectors. And also decision-making nodes changed in that process. So in multiple countries where we were working, our country directors would be joining ad hoc committees, steering groups that were set up to really try and centralize and coordinate these efforts. And so that really, just that very nature of kind of policy engagement shifted the way that we needed to work. And we really needed to keep up with that decision-making process as our partners were also responding in their own policy-making cycle. I would say the kind of process of co-creation, we often talk about co-creating with our policy partners, that process of facilitation, networking, the kind of long-term path to scale, thinking about capacity development, that suddenly shifted into our partners saying to us, we need your advice. What can you help us with? And ideally yesterday, so that shift from more of that kind of facilitative role into much more of an advisory focused engagement. And then lastly, I would just say about the funding here. So, this was kind of, in steady state, this was quite unique in that steady state, we would normally have a range of different funding sources, both multilateral, bilateral, private foundation. A lot of it is focused on these specific policy opportunities, as I mentioned, or systems strengthening, and that pathway is clear. Here in COVID, we were really focused on a much higher level of uncertainty. So yes, government partners will know that they have data needs. They don't necessarily know what their data needs are. And there's a chance that the data that we produce is not useful. It may be helpful, but it might not be. And so there's a higher risk level in terms of data collection. And so getting funding for that is also more challenging. So that ability to be agile, have that quick response funding, that wasn't really coming from our bilateral and multilateral funding partners as much, but foundations, small flexible funders, we found that incredibly useful to be able to take out to our policy partners. I will say just lastly, that's at the country level and what really shifted there. At the global level, and I think Danielle's description of just the number of actors in this, in the kind of ecosystem, just in Colombia that they were able to draw on. Now, if we take that out and zoom out to thinking about that in a global context, one of the other strong initiatives that that we really focused on was just trying to focus on information sharing. So we developed an online hub that was really just meant to be an information repository. So for researchers, a clearinghouse for researchers where they could share information about surveys, about what was being done in different countries, but also for policymakers and funders working at the global level to get a sense of what is going on in each of the countries. So I would say at the global level, where I think there's still opportunity for us to do a lot more, I would say, information sharing. We're not really set up as an evidence community to really have the right sorts of structures, forums, platforms to be able to share information effectively on what we're doing with the users and stakeholders who are interested. The funding, as I've mentioned, so I won't repeat. Communications, so policy communications was really important. So for us to be able to take this huge amount of data. So on that online hub, we had over, close to 200, I think, studies that in that very initial period were listed. Now, how do we communicate about the findings from all of those and make sure the data is readily readable and usable by data consumers? So the communications part, I think, is something that I would want our community as a whole to be able to focus on more. And then lastly, just our measurement. So, I think Danielle's description is really helpful in that, the priority needs to be on providing assistance, and research and data analysis is always going to be, insofar as it's competing with aid resources, that the priority should be on providing and will be on providing direct assistance to people who need it. But I think we can make the case for how data and evidence can be useful if we're also measuring the impact of that. So I think if we can also, as a community, think about what our measurement approach is and how we can have that increased accountability around the impact of our data and evidence in live policymaking processes, I think that will benefit everyone going forward. So I'll stop there. Thank you.
Thanks very much, Radha. You've introduced a number of elements that I think are going to be core to this conversation, going forward for the next hour or so, thinking about, how to mediate between evidence and policy, how to think about funding when needs are uncertain and ever changing, and how to think about information sharing and communications, including communication around, really making the case for evidence and why this is important. So that's really important. So Mariam Akmal, CGD is also playing a bit of a research role here, and would like to hear from you next, sort of as a researcher perspective. And so you are leading the work from the CGD side on a new project called Prepare. This is a multi-country education-focused initiative. And while it's not COVID specific, it's certainly kicking off in the context of COVID. And so that makes it very relevant to this discussion today. Hoping you can take a couple of minutes to talk about that, describe its sort of motivation, objectives, and its relevance for the discussion today. Thanks very much.
Thank you, Sarah. Thank you for the opportunity to talk about some of the work that CGD has been doing to enable evidence generation during COVID. To give you some background, here at CGD, we've been leading work on a new multi-country research partnership, which is focused on COVID, education policy response, called Prepare. It stands for Partnership for Research on Progress and Resilience in Education. Our partners include research institutes in Malawi, Ghana, Senegal, and Kenya so far, and we have plans to expand beyond that. And all of these partners are committed to helping domestic policymakers make evidence-based decisions in the wake of COVID-19, particularly related to re-enrollment, especially with a focus on gender, learning loss and remediation, and school reopening policies, among others. So we believe this is really important work, and we're very proud to be leading this initiative. So what's the motivation for launching this partnership? The motivation is twofold. So one, there is a representation problem in economics research, including in education economics. So there is underrepresentation, one, of research on developing countries, and two, research by scholars who are based in the global South. So there is, in fact, a strong correlation between research output on a given country and GDP. So a main goal of this partnership is to address that problem. We want to move away from the dominant model of partnerships where data is often collected by institutions in the global South, shipped to institutions in the global North for analysis and publication, and then delivered fully cooked to policymakers, perhaps with a launch workshop. Changing the status quo is at the heart of what we're doing. We're envisioning, true collaborations and true co-authorships on products with our local partners. And this is also really important for our capacity building goals, with CGD and the partners being able to learn from each other. A second part of the motivation for launching this partnership is the often broken link between research and policy impact. So this has always been an important conversation, but it's more important now more than ever, given the need to prioritize limited resources and the need to make data-driven decisions, to make difficult decisions in the wake of COVID-19. So we know that providing research information to policymakers can lead to policy change, but very often it doesn't. So this could be due to constraints on the research side, for example, lack of local ownership, the fact that the research is not responsive to local needs, or due to constraints on the policy side, for example, competing incentives for decision-making or missing local trusting relationships. So a big priority under Prepare is to address some of these constraints and to make sure that the evidence that we're producing is context specific, it's locally owned, it's responsive, and policy relevant. So for example, all of our partners have identified research questions that are of interest to the local ministries in their contexts, and our partners plan to stay engaged with them through the length of the process, from the beginning to the end. Many partners will actually embed folks from ministries and national statistical offices within the project itself. And this is really important for making sure that we're asking the right questions from the beginning, and to make sure that our answers are heard by the right people once we have them. So in a nutshell, for all these reasons and more, we're launching Prepare, and we're super excited about taking it forward. Thank you.
Thanks very much, Mariam. And again, I think we're going to talk a little bit more about partnerships, but clearly that's at the core of this work too. And really important for COVID response certainly is what do the partnerships look like? What are the roles are important, right? How do you think about who's asking the questions, who's involved, and who's in touch sort of throughout the entire process to make that a useful sort of policy relevant exercise? So taking it to the donor perspective now, we have representatives here with us joining us today from the World Bank, from USAID. And so Eunice, hoping you can sort of kick off from your perspective, from where you sit in the Ghana office of the World Bank. I know you've also spent an earlier part of your career in the Ministry of Education. Certainly you're not speaking from that perspective today, but can sort of bring that experience to bear as you talk about sort of how the World Bank's role has been over the last year or so. Thank you. Sorry, Eunice, if you could unmute.
So sorry, we talked about this. Yeah, let me just start by saying that in March 2020, the bank education team was working with the Ministry of Education and the Ghana Education Service, preparing a new project. So the pandemic sort of caught us mid-preparation for the Ghana Accountability for Learning Outcomes project. The question then was, how do we ensure that the Gallup, which was doing all the right things, and I'll go through the components of the Gallup, as well as the additional financing, which was supposed to respond to particularly to COVID and to the Education Outcomes Fund. So the question was, how do we ensure that the Gallup project would respond, would not become, would not be archived before it even began, by responding to this particular need, this urgent need to respond to the COVID-19 pandemic. So the Gallup originally was for US dollars 150 million from IDA, and with the additional financing, an additional 25.5 million was added on as additional financing. So our first responsibility, as I said, was to respond to the new needs that COVID-19 brought. Fortunately, the Ministry of Education and the Ghana Education Service has started to think about this. I mean, within March, this was really like a fast evolving situation. From one day to the next, we were, getting new information and all that. So they had started to think about this and came up with a response to the COVID-19, a strategic response to the COVID-19 pandemic. So then we could now take that strategic response, provide our input, and make sure that the Gallup would respond to that. So that made our work a bit easier. So not just the World Bank, but all the education development partners, including USAID, UNESCO, UNICEF, DFID, now FCDO, we all sort of came together around this strategy to support that. And for the bank, it was the Ghana Accountability for Learning Outcomes, which would support this. So I will dwell on the relevant components, but I just wanted to mention the original components, which were still relevant, even with the COVID response. So for the original components, the first component was to strengthen teaching and learning through support and resources for teachers. And this was estimated, had an estimated finance of about 50 million equivalent, of which the Global Partnership for Education added a 5 million grant. The second component was to strengthen school support, management, and resourcing, with estimated funding of 63 million equivalent and GPE grant of 5 million. The third component was to strengthen accountability systems for learning. And this is a really interesting component, because when we come to the discussion on data, existing data, and actually coming up with new data, this particular platform, the accountability platform that the ministry is trying to set up with this funding would come in really useful. And then we had a fourth component, which I will dwell on, because this fourth component has to do with technical assistance, strengthening, institutional strengthening, monitoring, and research. So research here is really important, because we had to think through with the government and with other development partners, what sort of research would you want to do? And so they have come up with a list of research. But then, of course, as time went on, this list would be added onto. On the additional financing, I would like to focus on component 5, which has to do with supporting the COVID-19 coordinated education response plan for Ghana. And so to continue with learning, to ensure recovery, and also to support resilience, just in case this happens again. Maybe not from a pandemic, but from something else that we have we could not see coming. And so for the COVID-19 response, the first subcomponent is to strengthen remote education service delivery. And so in this case, there was the need for content development, curation and delivery, and in-service training for teachers, because this was a new way of learning. And for basic education, teachers needed to be brought on board. Let us, okay, then for component 5.2, we also had supporting safe school reopening in anticipation that schools will reopen. Let us also remember that in the middle of March 2020, all schools had closed from kindergarten to tertiary. I think it was March 16th that all schools were closed. So we had to think about, if schools closed and reopened, how would we ensure safe reopening and re-entry? And then also we had component, the component on 5.2 had to do with ensuring that we were supporting the government to have water and sanitation and health interventions in the school, and also public awareness and communication campaigns for safe school reopening and re-entry, and also remedial and accelerated learning programs targeting poor performing students. And I think that, I mean, as soon as we started thinking about these, and the government already went ahead in terms of the digital learning and online learning, they went ahead, the bank was already supporting a secondary education project, the Secondary Education Improvement Project, which had come up with what they call the iCampus or iBox, which provided content and teachers actually teaching online some of the difficult topics to students. And these could be accessed by students. So the first thing the ministry did was to try to make sure that these resources were not only open for beneficiary schools under the Secondary Education Improvement Project, which was only about a little over 100, but available for all schools, secondary schools. So using some of these same experiences, they brought it on to developing a learning management system. And of course, the first question we had to ask was, how many children are on these systems? How many children are learning? Because remember, schools had closed. How many children are learning? How many children are accessing these systems? And what are some of the problems that children would have accessing these systems? So the Recover project, the Recover research that IPA did was really timely. And I think that during the dissemination, the ministry and GES were really interested in knowing how students were accessing these systems. And also they became, some of the indicators there became baselines for the project, because you could start by saying that, okay, at this moment, this is how many children, or the percentage of children actually accessing these interventions. And then from here, where do we go? How do we grow this? I also like to focus a little bit on component 4, which has to do with the technical assistance to the MOE to come up with research that they will want to supported under the project. And from the first list that came up, they were looking at the impact of learning grants, because under the Gallup, there was going to be learning grants to schools to ensure that schools had school improvement plans where they were actually going to improve learning, and these would be supported school by school. Also, they looked at effectiveness of innovative delivery of in-service training. How do they innovatively deliver in-service training in a way that is effective and using all sorts of technical and digital means. And then the third was effectiveness of school management committees, strengthening in improving school level accountability. And this was something that they wanted to look into. And of course, there was also an impact evaluation around one of the components under the additional financing, which is the Education Outcomes Fund, which is an outcomes-based funding, bringing in service providers who would help to improve the schools. I would like to end by saying that there is definitely a need for partnerships. We need to make sure that even with supporting the ministry, we are not creating overlaps. I mean, we should have situations where, for example, for the IPA research, it could be continued. For example, in the next 6 months after reopening, the government has just indicated that schools will reopen from the middle of January. So we are looking forward to that happening. And then in the next 6 months, and of course, the government also indicates that the digital learning and online interventions will continue. They are not just going to be stopped just because schools have reopened, so they will continue. So it should be interesting to see, to continue from there, 6 months after reopening. Let's see how many children are actually accessing and how we put out messages there to help children to access these online interventions. And secondly, I think what is really important also is co-creation. And I think it has been mentioned already, because co-creation allows us to have an easier time getting policymakers on board, because they will be part of it. If they have reviewed the TORs, if they have reviewed the inception reports, they know exactly what is in there. They've provided their input, and it becomes theirs as well as the researchers, and they can more easily take that on in terms of the recommendations. The other thing, the last thing I wanted to mention is accountability on the part of policymakers to implement recommendations. And one area that we thought was very promising was the research evidence workshop that preceded the annual education review, the National Education Review, also in short, NEW. This is an annual event. It also happened last year, but without the evidence workshop, which would look at researches that have been done with the ministry. I mean, usually there are over 200 participants, education stakeholders, who actually see these evidences, see the recommendations, and try to drive it into their interventions. Because once you've heard something and you are convinced, you say, okay, this is something that I could actually, implement in the little activities that I'm in charge of. So having that accountability on the part of policymakers and having the National Education Workshop as a way of looking at the performance of the sector, but also looking at how the government has taken on recommendations from various research that have been done, including what IPA did, would be very interesting. I'd like to stop here and allow other speakers to speak. Thank you.
Eunice, thanks so much. You really put forth a lot to think about, thinking about things which I'm sure that Josh, who will speak next, will be able to speak to as well. Think about how do you make sure that you sort of have this continued relevance of existing programs that can actually respond to needs. how do you think about, what are the key questions now for institutional strengthening, monitoring, and research? How has that changed? And then how can you leverage some of the data that's being collected right now to sort of serve the immediate COVID needs to actually serve sort of project monitoring needs going forward? And then certainly this question about accountability is important. And I do want to come back to you and push on that a little bit more later on as part of the conversation. Going to turn next to Josh Kaufman from USAID. Before I do, understand there might have been a bit of an audio glitch early on. So I just wanted to remind audience members that they can pose questions to the panelists at any time by writing to events@cgdev.org, by tweeting @cgdev, #CGDtalks, or via the YouTube live stream. And so feel free to send your questions and we'll make sure we have time to pose your questions to the panelists at the end of our discussion today. So turning to Josh, Josh, USAID has certainly been a leader in the US government's international COVID response, had to pivot some of the existing programs, certainly that USAID had been undertaking, also got new money to spend pretty quickly in terms of responding. Tell us a little bit about how the agency has used data to try to inform the agency's response, both to date and also in thinking about planning for recovery.
Sure, happy to, and thank you, Sarah, and thank you to CGD and IPA for hosting the panel today. So I guess it's probably the best place to start, as usual, is the beginning, right? So very early on in the process, almost immediately after COVID-19 was declared a global pandemic, so this was in March of last year, the agency stood up the COVID-19 task force, which is consistent with how we operate when we're responding to significant man-made or natural disasters. And the remit of the task force was primarily to respond to the immediate crisis, whether it was health or humanitarian, and then some of the immediate sort of second order impacts, the broader development impacts. But it was clear almost immediately that this was a much different response and a much different problem set than we were used to. First and foremost, it was a global health and humanitarian crisis. So the scope of it was unprecedented. Secondly, it was immediately, there were spillover impacts almost immediately, whether it was elections being canceled, rapid increases in household impacts around poverty and food insecurity, schools being closed. So for want of a better term, it was a global development crisis. And then lastly, the operational issues, right? So that was obviously had a direct impact on USAID's operations, but more broadly, right? The entire global development ecosystem, host country ministries, civil society actors, other donors, researchers, implementing partners, and that these three big impacts were clearly going to continue for months and years ahead. So early on in this process, we determined that we had to also step back and effectively plan for the medium to long-term impacts of COVID-19 on our national security in the United States, but on our broader development and humanitarian landscape. So that process was called Over the Horizon. And again, the purpose of which was to better prepare us for those medium to long-term impacts. The place to start then was, how do we understand what those medium to long-term impacts were likely to be? And I say likely with a lot of asterisks and humility, because we knew we were going into a period of extreme uncertainty. But we also knew it was very important for this analysis to be as data-driven and evidence-based as possible. So we undertook two sequential exercises that were designed explicitly to draw on as much data and evidence as possible. First was a brief landscape analysis where we looked at what were the immediate trends that seemed like they would be most likely to continue out, say, 3 to 5 year timeframe. So we identified 5 of those trends. One was around national security. And both the fact that it was having such a significant and continues to have a significant direct impact in the United States, but also that the pandemic was playing out in a period where we already were seeing heightened great power competition and other things. And then also, obviously, the direct and indirect health impacts. Here we are, we started in March, almost a year later, and we're obviously nowhere near getting the direct impacts under control, and then the spillover impacts on health systems resilience and other things. And then looking at issues around stability and democracy and governance, where there certainly has been organizations like VDEM and others have documented backsliding instances of governments taking advantage of COVID to further limit freedom of association and other key freedoms. And then essentially like a dual economic shock. So a macroeconomic shock and a shock on mobility, leading to things like dramatic decreases in foreign direct investment, remittances, supply chains being disrupted, and then a microeconomic or household level shock, particularly impacting communities that were already vulnerable or marginalized. And so here's where we're seeing, these unfortunate estimates of upwards of 100 million people that are now newly under, increases in extreme poverty, similar numbers for food insecurity, over 1 billion kids out of school. And so the landscape analysis paper is published and again is very data driven. But then we needed to go a step further. It was clear to us because we needed to really take that sort of snapshot and walk out sort of 5 years. And so we did something which was unprecedented, at least at USAID, where we convened sort of internally, so as internal staff, a agency-wide scenario planning process. So we had over 75 staff and we had 5 distinct teams along each of those 5 trends that I just laid out. And the idea was to look at sort of best case, worst case, and sort of middle ground scenarios that might play out over the next 5 years. The explicit purpose of which was to inform the decision makers, the senior decision makers in the agency, to help determine sort of what priority objectives we should identify in terms of the medium to long-term impacts of COVID. And so we were looking at things in these scenarios, not just on what possible outcomes would be, but also what that said about where USAID's comparative advantage was, or where donor assistance more broadly could have an impact or not. And so through that process, we have a summary of the scenario planning exercise is available online. The full document is very long and for a variety of reasons was not made public. But we did identify 3 core objectives coming directly from that scenario planning process to help inform our response to COVID over the next, say, 5 years approximately. So one was very much around looking at stability and resilience at the national level. So looking at countries that were increasingly fragile because of COVID, oftentimes countries that were already had significant challenges when it came to fragility, and where we thought sort of at the institution or the systems or the national level, USAID could effectively provide support to try to make those countries more resilient. If the first objective was sort of at the national level, the second objective was at the opposite end of the continuum, and it was really looking at the household level. Again, primarily around populations that were already marginalized and vulnerable, and what we could do, what tools we could bring to bear that would address some of the immediate impacts around poverty, but also food insecurity, education, loss of access to water, sanitation, and hygiene services, and other things like that. And then the last objective, the first 2 really cut across what we would sort of call our traditional sectors. The third one was very much embedded in a single sector, which was health, primarily focused on health systems resilience and health security for obvious reasons. And then we also used data to then help us understand where we might want to prioritize, or focus is probably a better word, geographically. And we did that by looking at 2 distinct sets of data. And we did this by each of the 3 strategic objectives. So first, we relied on our existing country roadmaps and data sets that we've been using for what we call our journey to self-reliance, which are all online. And we do these annually, and we have 17 third-party indicators that we use primarily, but then we have a whole set of secondary indicators that numbers well over 100. So we identified sort of key indicators that align with each of those 3 objectives to try to understand what the baseline pre-COVID need was in each of those areas. And then as part of the task force, we established a COVID data and analytics team that was doing a parallel exercise, again, using primarily third-party metrics or data sets. I was, in a good way, very pleasantly surprised how quickly organizations pivoted to start to develop and publish almost in real time impact data on COVID. Obviously in the health, we relied on Johns Hopkins for health, but looking at the political impacts, the poverty impacts, et cetera. So we were able to get fairly granular at the country level and also then look at, for want of a better term, COVID need. And we kind of took a split the difference approach where we equally weighted the 2. like we sort of had arguments back and forth, which were somewhat policy arguments. Did we want to primarily start by looking at countries that were already identified as high need areas, or did we want to be very responsive to new or sort of COVID need, and we sort of split the difference. But we used that to take sort of our first cut at identifying focus countries was entirely data driven. And then obviously we applied other important lenses, including where we thought we had the ability to make a difference, which is more of a qualitative assessment, but also looking at things like national interests and other things. So we ended up ultimately with a list of 14 focus countries, which again are on our webpage, and that are identified against each of those three objectives. So some of those countries are focus countries for a single objective, and some for 2 or 3. I think I'll keep it there because I know we won't have a schedule, and I'm happy to get more granular if it comes up during the panel discussion and Q&A. But I again appreciate this opportunity. Thank you.
Great, thanks very much, Josh. You know, a couple of themes I think that are recurring to is this theme about trade-offs too. In some ways, you mentioned the need to sort of concurrently plan for the immediate response as well as concurrently planning for a medium and long-term response. And how do you think about how you devote your resources to both of those kinds of things as well, and what kind of data needs will serve those, and how to prioritize among that. You know, thinking about where donor assistance really fits in, what is USAID's comparative advantage among that. And then also at the end, you talked a little bit, or you mentioned in passing about how quickly people are really being able to publish data and information that are useful for thinking about COVID response. And actually, this brings me back to something that Danielle mentioned early on, which is the importance of these kinds of evidence gap maps. And this can be something that is, sort of within country, looking at what kinds of evidence does a particular country policymaker need and have, and to be able to prioritize those questions. But looking sort of more broadly at sort of a global scale too, where is the research and evidence emerging? And how can you think about coordination to be able to either focus resources on a core set of questions or be able to try to fill in gaps where necessary? So we have about half an hour left, I think, for the discussion part before we turn to the question and answer from the audience. So I want to go through some of these next questions a little bit quickly maybe, but I do want to make sure we pull on a number of threads that really emerged in all of your introductory remarks. And I think one of the core ones that really came to the fore was that of partnerships, right? This is something that basically everybody mentioned in some form or fashion. And so Danielle, I would like to start with you. So you mentioned a number of different partnerships. I think I lost count. It might have been about a dozen that you just mentioned, and I'm sure that was only a subset of the kinds of organizations and other government ministries, et cetera, that you really needed to work with to be able to sort of identify priority evidence needs, collect data, analyze data, finance these efforts. And so, thinking about this sort of urgent, fast kind of approach that you had to take to be able to develop these partnerships, what do you think makes or made for really constructive government researcher donor partnerships, and what are the core challenges?
Great, thank you very much. I'm going to draw also on some of the comments made by previous participants. I'd like to maybe I didn't mention it, but I think that also a lot of people mentioned the need to kind of change our paradigm in terms of how we use knowledge and evidence. And here I'm thinking about how to innovate faster within the public sector, and that's a big challenge, and how to use this evidence to really on the go start to fine-tune programs and make them more effective. So now I'm turning to the partnerships, the main challenges. So I think that the first thing is that legally we have a lot of restrictions in terms of the speed and partnerships that we can make. I know that all of us face these restrictions, and these impose timings that are hard to deal with in the context of an emergency. If we want to work with USAID, then there are certain time frames that we have to respect, and we have to go through the paperwork. Likewise with researchers, likewise with all the different partners that we have. So I think that the main strength in Colombia was to build on existing partnerships and workflows to be able to leverage those existing agendas and refocus them a little to be able to respond faster to COVID. So that's the case, for instance, with our work with the World Bank, with the IADB, with the OECD. All those different organizations had work programs with Colombia, and I think that one of the responses that we had was jointly to analyze how we could refocus our work program, accelerate certain components that were more relevant in the context of COVID, maybe change the timelines and speed up things that were more relevant. I want to illustrate a bit of the challenges that we faced and the way we leveraged these partnerships using our cash transfer program. It was a new cash transfer program. Colombia had already, we have 20 years of experience with conditional cash transfers, but we didn't have a non-conditional cash transfer that would be useful for COVID to protect those households that were losing rapidly their income during the emergency. So designing this program was immediately a priority, and there we used our partnership with the World Bank, for instance, to do the initial diagnosis. What is the impact on poverty, on inequality, on extreme poverty that will be faced due to the lockdown measures taken, due to firms shutting down, due to the spike in unemployment, all those factors, how will they impact poverty, to have an idea of the scale of the program that we had to design. So this was done with the teams that we always work with. And I think that's important. You have to have your networks of work partnerships between governments, research institutions, multilaterals, donors, and be able to modify those work agendas fast enough to be able to respond. So there, the work with the World Bank was very successful. In terms of building the program, we had also to use emergency conditions, and that was very useful in Colombia. It's controversial, I think, in terms of it shouldn't be the case that we can work very fast only under emergency conditions, but the emergency decrees allowed us to move forward in terms of the norms, the paperwork, a lot faster. So that was very important. We had under those emergency decrees the ability also to, for instance, match and work with different databases that in normal conditions would take 6 months, 8 months, a year to only get started, to get all the confidentiality things going, to have all the paperwork done between the different entities of government within government, So under the emergency decrees, we had the ability to actually bypass a lot of those procedures, and that's a lesson learned that we want to also use in terms of the reforms that have to be put in place going forward. Working with the private sector, I think that the emergency really helped align incentives and align expectations between government and the private sector to be able to build this program very fast. So in particular, the work with the financial institutions in Colombia, the telecommunication networks and service providers, that was work that in normal conditions, it would take a lot longer. When we approached the financial association, the Association of Financial Banks in Colombia, they were more than willing to work with the government very fast to really build this program and operationalize it a lot faster than would normally take place. We basically built the program in a couple of weeks. So this involved doing all the data work, doing all the analytics behind the size of the program, the money required, and mobilizing the funds through these emergency decrees. So I think this is a very nice example of how we aligned incentives, and also in terms of building knowledge. We partnered immediately with the IADB to build the impact evaluation of the program, and that's ongoing. And we also, we were approached by two researchers, one at NYU, one at UCLA, that wanted to evaluate another program, the program of VAT compensation that was scaled up very fast to be able to transfer funds very rapidly. So I think that incentives were aligned really in terms of building partnerships a lot faster than in normal conditions.
Thank you. A lot of great examples about sort of leveraging existing partnerships, thinking about how to incentivize new partnerships, et cetera, as well too. So again, we're a little bit short on time, so hopefully we can get through a couple of additional questions too. But I want to ask sort of a similar question, but from the research side to you, Radha. And so, IPA partners with policymakers all over the world. And so, wondering if you could tell us from your perspective what you think sort of the characteristics of these sort of good policymaker research or partnerships really look like. You were talking about how, especially how does it look like when you need to think about, changing sort of that mediator role and thinking about when needs become more diffuse and when decision makers, the locus of decision making changes.
Yeah, thanks, Sarah. So I think a lot of the good ingredients that go into these interactions and partnerships have been mentioned. So the co-creation focus, the drawing on very local, field-based, contextual knowledge and insights to inform what data needs are. But also, and I think it's data is not the end. It's the policy change that is the end. It's the impacts that is the end. So it's really being able to work backwards from that with that mindset. I think a couple points that I'll raise, though, that I think haven't been touched on as much. So I think one thing is just, we've really found it useful to be quite structured and make the translation of data and what you do with data and what a policymaker can do with the data that is made available to them in terms of their strategy. Facilitating that process and structuring it just makes it that much easier for them to do their jobs, right? So we know that especially in a crisis context, that our government partners are very strapped. They're, priorities, there's multiple priorities they are trying to address at the same time. So the more that we can get to thinking about what are the specific data needs, but then also let's go through the policy planning process with you. So let's think through, once we have this data, if it shows us X, this is what the pathway to change will be. If it shows us Y or Z, these are what the potential pathways mean. So really trying to think through what's that kind of pre-policy plan rather than just a sort of pre-analysis plan from a research perspective, but really thinking about what the policy implications will be, I think, is quite helpful. And doing that jointly with our policy partners is very useful. One thing that I also want to touch on that's just I don't think we've mentioned so far, but I do think is needs further discussion is around just the drawing on and trying to support existing our government partners' capacity in data analysis and use. So whether it's the statistical services, whether it's the information, in some cases it's innovation labs, and others it's data departments within ministries, wherever those data collection, analysis, M&E kind of units may be. It's been really key as well, especially in this COVID response, that we're not just thinking about how we collect data, but how we're also supporting those organizations through technical assistance to be able to also make those transitions. So Ghana was a good example where in May, we really did start, instead of just focusing on our own data collection efforts, really working with the statistical service there to help provide technical assistance for them to conduct their own surveys and develop that administrative data that would then be used for government decision making. So I would say just really thinking, in addition to some of the things that have already been mentioned, but really just thinking about how we can best support those existing assets that are there and all move in that transition together, and really just working on some of that research to policy translation in a very kind of structured and specific way to just help ease the process along.
Great, that makes sense. And so, actually that leads me to a question to Eunice, who at the beginning mentioned, the work that they did with sort of the evidence summit, I guess, around evidence too. And so, thinking about, the role that maybe a donor or the World Bank could play too, and thinking about how do you think about sort of building capacity or building interest in building the demand for this evidence to be able to, for policymakers to really be able to make these evidence-informed decisions. And so, what actions by a donor like the World Bank, by research teams, by others can really help encourage policymakers to prioritize and to be able to really use the evidence that is generated in order to sort of help inform their decisions?
Thank you so much, Sarah Rose, for asking this question, because I was just putting my thoughts together to sort of respond to the general question you had at the beginning. And this was one of the things I was going to talk about. So let me start with the idea of having structures and having events and just having plans around some of this data, evidence, analysis, analytical work, and so on. The ideal situation, in my view, would be to have a research portal where ideas are shared, where research peer-reviewed, properly peer-reviewed reports are hosted, and where people can come from the various stakeholder groups, development partners, government agencies and clients, academic and research institutions, independent research institutions like the IPA could also go there and post their ideas and, for discussion. The second thing, and which is something, so the next best thing, so not having this portal, because we actually attempted to have something like this in another project there, another World Bank project, but it didn't go to full fruition. So we don't have the portal, but all the work towards, having that discussion and having, hosting that, it went really far, but it didn't go as far as we wanted it to. The next best thing would be an evidence summit, where all stakeholders will be committed to. Fortunately for Ghana, we do have the sector working group, which includes stakeholders like development partners, NGOs, and as well as the government. This sector working group is co-chaired by the development partner lead, which currently is UNICEF, and then the chief director of the Ministry of Education. And at this event, at this meeting, which is supposed to be held every quarter, is where we bring all these ideas, where we ask questions like, have you seen this research? And this is what it's saying. How do we ensure that you can, implement it or use it as part of your policy? So this, I think we should hold dear such structures and make sure that these structures are working. And it's not just the World Bank, but all development partners supporting the government. And the whole idea of the Secretary Working Group came about because development partners rallied around the education sector plan, which is quite different from the COVID response. So that was a call that came in. I'm sorry, I had to just put it off now. Getting back to my train of thought. So the next best thing would be those meetings where we actually discuss these. I would also like to mention that policy responses to evidence may not be very straightforward. So depending on the context, the government may say, okay, this is not the right time to actually implement this. It could be that elections are coming up or something else is happening, and we really don't feel comfortable about using this information right now. But we could give it some thought and use it later. So they are not very straightforward. So it's an ongoing discussion. I think the other structure I would like to talk about is something like what we are trying to do under the component 3 of the Ghana Accountability for Learning Outcomes project, which is the accountability framework. So this is supposed to be a portal that pulls into it data from the Education Management Information System. And the Education Management Information System has been around for years and years, since 1990, when they were paper-based. And now they are partially digitized with support from USAID. And under the Gallup, we are trying to get them to be fully digitized so that, you know, even the data entry, the data collection will not be physical. It will be done and sent on the internet. So this is something that is being pulled into the accountability framework. Another data source that's also being pulled is the mobile school report card. The school report card was actually started in the Ghana Education Service, but then the mobile school report card was an enhanced version of it where circuit supervisors would use tablets to actually enter the data, and it became the mobile school report card, and it was supported by UNICEF in several districts. So all these data will be pulled into the accountability framework. I think the question that the ministry, the Ghana Education Service wanted answered was, where can I press a button where I can know that 90% of teachers attended school today? Where can I press a button where I can know that in 100 schools, they haven't done well for, you know, this number of years on the BEC, for example? I mean, that data is still available, but there's no one point where you can get it easily. So in my mind, I mean, while we talk about research and all that, I'm also thinking about administrative data and how we make use of administrative data. There's so much data that's available. Even now with the learning management system, the back end has a lot of data about the characteristics of children who are using these online facilities. So I would like us to, while we look at research in the sense of, you know, randomized trial research, we are also looking at the data that exists that can help the client to make informed policy decisions. Thank you.
Thank you so much, Eunice. A really important discussion of sort of what policymakers' needs are and how to be able to really meet those needs and where they are. So we're about at the end of our time for the discussion, but I want to ask a little bit of a lightning round, 3 more questions, if we can do that. And some of this, I'm going to take this into sort of the forward-looking kind of question as well. And so, Mariam, I wanted to ask you, so your work is also very much focused on how to get policymakers to use evidence, and how do you build sort of the evidence generation such that it lends itself towards better use in the end. And so wanted to talk a little bit about what you're doing with the prepare work and compare that with something that CGD had done earlier on. CGD had supported a phone survey in Senegal with a research partner located in Senegal to try to, you know, look at what was happening in the pandemic, what the government's response was, et cetera. And so I'm hoping that you can just take maybe like 1 minute to do a quick comparison of sort of the prepare work and that work, and talk about sort of how those 2 partnerships looked different, and then use that to sort of project forward what you think going forward will be important to focus on in terms of crafting partnerships that are really conducive towards good evidence generation, really good evidence use, and improving really representation too, and how you think about asking the questions and getting answers.
Mm-hmm. Sure. So there are a couple of key differences in our approach to the consortium that we're building under Prepare and the first phone survey that we launched in Senegal, which was almost a year ago. And I think the main differences are tied to the element of speed. We wanted to move really, really, really fast with the first phone survey that we did in Senegal. And now we have some additional priorities under Prepare that we want to balance with that. So we were able to, under Prepare, quickly mobilize our existing local partnerships to form this consortium, which is important, like Daniel also talked about. But in terms of process, we do want to balance speed with being deliberate about involving key policy players, about fostering strong local ownership, about creating opportunities for collaboration and cross-learning, like Eunice mentioned. And all of these things take a bit of time, but they're also very critical as we start thinking about moving from the immediate short term to some of the medium to the longer term impacts. So to give you a very quick context, back in April 2020, CGD colleagues launched a phone survey to assess the economic, health, and education impacts of the crisis. We did this a few weeks after, Senegal announced a curfew, banned public gatherings, closed its borders, shut down all its schools. And the findings, were very useful and showed at the time that more than 85% of the population had experienced a drop in income. More than a third of the kids were not engaged in any kind of learning at all. And this was, to my knowledge, among the first efforts at the time to release data on the impacts of the crisis. And our experience in Senegal really showed us that it is feasible to quickly and cheaply collect good quality data using mobile phones in a crisis situation. And in a way, that experience and that of IPA and others who've been actively involved in doing phone surveys during COVID helps set the foundation for part of what we're doing under Prepare. So, with Senegal, obviously, back a year ago, it was encountering a situation that the world had never experienced before. So speed was of the essence. So with Prepare, some of these other factors, like being more deliberate about involving ministry officials, national statistical offices, and key players, has sort of also become important for us. So for example, our partner in Malawi is working directly with the National Statistical Office on the Prepare project. Similarly, Senegal is working, planning to work directly with ministry officials and the National Agency for Statistics and Demography there. And it's important for fostering local ownership. And the second, with Prepare, there's a more systematic focus on collaboration and cross-learning. So we've tried to institute mechanisms where various partners can learn from each other and talk to each other, for example, through joint sessions for knowledge exchange. And again, speed can sometimes hamper these other concerns that I've highlighted. So obviously our partners bring rich experiences that are embedded in the local context that are critical for the research process. But then CGD, on the other hand, is able to sort of provide help with synthesizing cross-country findings or providing amplification in terms of global policy engagement or technical support in terms of data analysis. And some of these opportunities, such as cross collaborations across a wider set of actors, promoting capacity building, can be tricky to capture when you're moving really, really fast. And with Prepare, we're trying our best to strike a good balance on that front.
Great. Thanks a lot, Mariam. So Radha, question for you too that I want to ask. So we focused a lot on partnerships, but I also want to talk about sort of data collection and methodology kinds of issues as well. And so hoping you can tell us a little bit about sort of looking at IPA's portfolio sort of more globally. How did data collection change during crisis? People have mentioned sort of the need to work quickly, and then people have mentioned the need to sort of slow down and think about sort of longer term. But, at the same time, there were issues with movement and access, and that still continue to today. And so, looking across your portfolio, how did you really see evidence systems, adapting? And then what adaptations, I think promise to be useful looking forward, sort of going beyond the crisis that we could use not only for our future crises, but also what are useful for being able to generate evidence, more broadly to really meet the evidence needs maybe more quickly and more cheaply, to really be able to sort of prove their utility and really gain more of demand for it. Thank you.
Yeah, those are great questions. So I think, and I think that frame is right, because we were kind of forced, the pandemic sort of forced us to make a pivot in our face-to-face data collection activities into phone-based activities. And it was probably a direction that we should be moving in. And this, the pandemic was really just a catalyst that forced us to do that much more quickly and aggressively. And I'm not, I won't hide the fact that it was no small feat. Like that was an immense amount of work to be able to essentially, we've had a number of our country offices have call centers where they're used to being able to do phone surveys, but from, essentially a call center construct within the office. However, this was a completely different setup where essentially we were saying, can staff and enumerators do this from their homes? So all of the issues of just making sure that they have the technology available, that there's privacy, that there's security of data, that they're able to, do they have data connectivity at a sufficient level to be able to do this? So there was just the logistics of doing that was quite a large undertaking, but the country offices really did work through that, and And in some cases, you know, it was, I would say, like Bangladesh is one example where I think at one point we had around 250 people who were on staff who were conducting phone surveys from their own homes in any day. So that was quite a large growth in terms of just that investment. Now, I think so there was that switch to phone surveys. However, it also came with a lot of questions. So we know, and you know, IPA has a whole kind of research methods agenda as well. So to try and understand, you know, what are we doing and how effective are we? So, you know, questions around sampling, you know, at the outset, there were a number of questions around sampling, and if we're using national data sets versus random digit dialing, then what would be the implications of what we might find and what would really be representative in terms of what we're offering and really understanding people's response rates. You know, who is answering the phone when we call? I know I don't generally answer calls from numbers I don't recognize here, but you know, who is doing that? Who's more likely or less likely to do that? And thankfully, we had a lot of metadata on who was answering or not, so that we could see, for instance, in Colombia, there were many more women who were willing to answer the phone than in some of our sub-Saharan African samples. So, you know, drawing out distinctions like that. We were able to do some methods experiments. So being able to see, like, does it improve your response rate if you text people ahead of time and say, would you be interested in participating in this survey? And if they respond, then they answer, you know, or if they, that sort of thing. Also thinking about just women's, you know, the gender issues about access to phones, and then also just safety, you know, safety and issues around privacy when people are answering the phone and what they're willing to speak to and not. We were able to also try and explore some of that. So there are a number of changes that took place. I think that those changes will stick. You know, I don't think it's going to replace something. I don't think it's going to replace face-to-face. There's a number of questions that you simply can't ask and answer on the phone very well, particularly around more sensitive issues, without it being quite difficult. So things, you know, IPV, intimate partner violence is a core area where we've really tried to focus. We put out some guidance on, you know, how those kinds of questions could be asked. But if you're looking at, you know, if you want to really get into the kind of nitty gritty around prevalence and other things, then that's not appropriate for a phone survey. So I think that what this will be is, you know, an additional tool in our toolkit, and one that we'll use more and more easily. And we've kind of accelerated our pace of use with it. But I don't think it's going to replace some of the face-to-face pieces, because there's just something to that interaction that really changes the quality of engagement.
Yeah, thank you. And so that's important for thinking about the future. And so things that have changed and can persist into the future, and things that, of course, it's not going to be a complete shift and how we sort of approach evidence collection. So I want to leave we do have a couple of questions I want to get to from the audience, but before we do, Josh, I want to give you sort of the last word of the panel discussion. And if you'd be willing to talk a little bit sort of about the funding side of this. And so one of the things that people had mentioned, certainly, you know, in their perspective of how things have been over the past year, is that, you know, there's been a lot of uncertainty, right? And there's been a lot of uncertainty about what kinds of data need to be collected, what kinds of responses are going to be necessary. And this is all shifting kind of quickly. From a funder's perspective too, how does that look in terms of being able to respond to that as needs are evolving? And what kinds of things can help a funder be able to pivot in a way that is really responsive?
Yeah, that's a super complicated question, so I'll try to answer it quickly. But I think, you know, that's important to have the broader context as well, which is, I think, you know, potentially concerning. So if you look at some of the larger European donors and their foreign aid budgets are oftentimes formulaic as a proportion of their overall budget, which I think was largely done to make sure there was a floor for funding, to increase funding. But given the financial crises that a lot of countries in the global north are undergoing, we're actually seeing some real decreases in ODA levels coming out of, say, some of the European donors. We've been lucky so far at USA. We haven't really seen that, in part because we have really strong bipartisan congressional support. But issues of funding, over the last year were obviously kind of politicized in the US context as well. So if you look at, say, the amount of supplemental funding that went towards the Ebola crisis versus the amount of supplemental funding that's been specifically earmarked for response to COVID, it's still out of proportion, right? So if you look at OECD just released their report towards the end of last year about the increases in sort of essentially funding gaps for the SDGs, and I think it increased to 2.7 trillion, right? So that's a huge unfunded mandate, I guess is one way to look at it. So when we're talking about shifting of funding in the USAID context, for us, we're really looking at it more at a micro level rather than a macro level right now. We don't have significant dedicated COVID response funding. That might change in the future. So there, I think data is really important. And so I could give a few examples of that, but I'll try to do it really quickly. So one is, how could we be responsive to some of the most significant trends that we're seeing at the country level coming out of COVID? And I'll give examples of two. One is social protection, and we heard about that in the Colombia context. So the estimates are now over 1/5 of the world's population is benefiting from some sort of social protection scheme, which is a huge increase. It so happened at USAID, we had developed a pretty strong evidence base around unconditional cash transfers over the last 3 to 5 years. We did sort of multi-year impact evaluations to try to ascertain both the sort of the impact of cash transfers, but also the relative impact potentially compared to some other types of donor development interventions. So I'm hoping we'll be able to leverage that data at our mission level as we're supporting governments in terms of increases in social protection. Another, I would say, is just the massive jump in the pace of digitization of economies, of schools, et cetera. But really, that has made the trend of sort of digital inclusion and gaps in internet access even more important. And so, we had piloted a digital ecosystem fund. We had generated a lot of evidence. We just last year published our digital strategy. So we were able to scale up modestly, hopefully it'll grow, but scale up this pilot digital ecosystem fund. And in fact, some of the data that we compiled through Over the Horizon in terms of country impacts and everything we're used to help guide that. But I also think it's within projects having, and this gets at the partnership aspect of it, right? So I think we have very strong partnerships, particularly with in the agriculture and health sectors, both at the ministry level, but also at the community level. So community health systems, et cetera. And when we're trying to track the immediate impacts, those partnerships generate vitally important evidence. So for example, looking at the fact that food insecurity is becoming increasingly a urban and peri-urban issue as opposed to just a rural and peri-urban issue, and really needing, having the ministry partnerships for us to understand the sort of the data that's underlying those impacts. Or certainly at the health level, at the sort of community health level, for example, when we were looking at sort of scenarios and trying to map out impact, one of the most disturbing secondary health impacts was just the huge number of children that are under threat to miss measles and polio vaccines, for example. But talking to UNICEF this week, they're starting to document, it's too early to know for sure, but a rebound, and that families maybe are becoming increasingly willing to bring their kids in to get vaccinated. They have yet to see a similar rebound when it comes to births that are where a health worker is present. So we might be starting to see an important differentiation in terms of the secondary health impacts, where maybe we hopefully will see vaccines rebound, but maybe additional work would have to be done in terms of making sure that mothers are willing to seek care and have births where there's medical professionals present. I know we're just about out of time, so I'll leave it at that. Thank you.
Yeah, thank you very much. So we are just about out of time. I want to ask one question that's come in from the audience and leave it to any panelists to answer who would like to, and then we'll close up. And this question comes from Laura at the Asian Development Bank. And she asks, As part of its COVID-19 response, the Asian Development Bank has developed an online mapping tool to identify and locate companies supplying materials and finished products for PPE and COVID-19 treatment equipment to help stakeholders better identify companies involved in these international supply chains and address bottleneck issues. So Laura would be interested in hearing panelists' thoughts on what role they see for regional MDBs like the Asian Development Bank in transforming tools like these into action in combating COVID-19 worldwide. If there's any panelists that would like to speak to that, we would welcome an intervention and before we close. Well, it certainly seems like something that's particularly useful, you know, we'll look forward to hearing more about that. Perhaps a question for further conversation, certainly going forward as well, and something that CGD could explore. It sounds like a really interesting initiative to be able to understand more about. So we are now at 11:30, and I just want to thank everyone very much for joining us today. A huge thanks to our panelists for sharing their expertise. Big thanks to Innovations for Poverty Action for co-convening this event with us today. And of course to you, the audience, thank you so much for sharing your time with us. Thank you.